welcome back to another episode of the Hormone Prosperity Coach as we dive into talking about a question from Mavic, who wants to know about different dosing routes for HRT, which is a question that I see often. A lot of you are confused about, should I be using a patch? Should I be using a cream, a pill, a shot, like a pellet? What should I be doing? So let's dive into this question that Mavic proposed. She says, what's the latest on oral versus patches versus gels for HRT? I was initially prescribed patches, but that horribly irritated my skin. The adhesive question mark. So I'm on oral estradiol and progesterone, but are these oral pills less effective? I'm wondering about trying gels or spray that I've read a bit about in case the oral isn't as helpful slash protective. So thank you for this question, Mavic. I love it. There is so much to dive into here for all of you hormone seekers, hormone finders, hormone users, because, so much to dive into. So the first thing, I'm gonna circle with my red pen the things that really catch my attention that are crucial alerts that need to be addressed. So number one is you say I'm on oral estradiol and progesterone. Oral progesterone, no problema, cool. That's my favorite way to dose it for women because it can help with anxiety when it goes through the gastrointestinal tract. It stimulates the nerves and neurotransmitters that go directly to your brain. Your gut is your second brain, and it helps your GABA neurotransmitter, which is your calm anti-anxiety, and it helps with sleep. Love progesterone orally. Now, estradiol or any estrogen orally or testosterone, no, step away from the oral estradiol, the oral testosterone. Why? Because when you take estradiol or testosterone orally and it goes into your gastrointestinal tract, there's something that happens called the first pass effect. First pass effect, where these hormones go into the bloodstream that go right to your liver through the portal vein. They go from the gastrointestinal tract, collects the blood in the veins, and then it goes right up to your liver, the portal vein, into your liver. Now, your liver is the main sanitation department or detox central for almost everything in your body, most things, and especially your sex hormones. So you have a flood of sex hormones, estradiol and testosterone, coming to the liver. And what that does is it overloads your detox profile and it causes biochemical changes that can actually increase your risk for, well, heart disease for one, but other health problems as well. And we call that the first pass effect. It doesn't happen with progesterone. So you do not want to take estrogen or testosterone in an oral capsule. Why it's still on the market, I don't know. Now, I say I don't know, but why, if you want to ask anything about the pharmaceutical industry and why it's allowed, it's always a for-profit motive because a lot of women are not comfortable with the idea of using a patch. And that's really the only other route that we have right now for estrogen for women that's commercially prepared by one of the big pharma companies. So that's an aside. You want to step away from the oral estrogen and testosterone. It can contribute to all kinds of hepatic and systemic problems. So one thing you said is you were horribly irritated with the patches by your skin. The adhesive, yes, the adhesive is made up of chemicals, primarily petrochemicals that come from fuel. Most of the medical industry's products, even the medications that we take, are made and synthesized from petrochemical byproducts. You probably didn't know that, and that actually was part of the inception of the big pharma industry many decades ago. Was Rockefeller and a bunch of these other wealthy magnates had all this petroleum leftover byproducts, and they were wondering what to do with it. And some genius scientists came up with, we can use it to manufacture pharmaceuticals. And so that was one of the reasons why the pharmaceutical industry at its inception grew so rapidly, because they had to use up these very cheap products. So anyway, I'm off on a tangent, back to the estradiol. So adhesive using the patches. The adhesive can be irritating to people and probably to more people than admit or realize it. They tell you to rotate the location of your patch every time you place it. So that probably is to minimize the chemical sensitivity reaction of your skin, a healthy, normal reaction to a toxic substance, albeit a mildly toxic substance for most people. Most people will react to some type of bandage that has a petrochemical byproduct in it. It's not a naturally occurring substance. So I'm not surprised that you had that. I've had that with a lot of patients too. I love the transdermal creams. That's my first choice for estradiol for women, because usually there is no sensitivity. They put it in an organic, hypoallergenic base without perfumes, dyes, or petrochemical additives. So it's a rare, rare patient who ever has a reaction to the transdermal cream. Now, it sounds like you're working with a mainstream doctor because they've put you on an estradiol pill and a progesterone pill that you're taking two of in the morning. That's for sure a mainstream medical prescription, because that's what I used to prescribe when I didn't know what I know now. So they're probably not comfortable or versed in prescribing transdermal cream. So you'll need to find a doctor who knows and is trained in prescribing, dosing transdermal creams and the management and proper testing of it. You cannot follow cream dosing with blood tests. You can't follow any of these sex hormones dosing with blood tests. Let's just put it there. And the only way that mainstream doctors know to test anything, if they know to test sex hormones, is in blood tests, and they will be incorrect. So you're going to need to find someone who is trained. And I don't mean someone who went and took a weekend course. You need to actually check. Did they do a fellowship in functional medicine, anti-aging medicine? Did they do one in naturopathic medicine? What is their training? You really, gone are the days when you can just go to someone who says, oh, I do bioidenticals, and you're knowing that you're getting the highest level of care, because there are so many of these little mom and pop courses that pop up just for a weekend, and doctors and nurse practitioners and physicians assistants can go and take these, and then they can hang out a shingle and say, I do bioidentical hormones. But you as the consumer don't know what you're getting, and you need to question, what is your training and how long have you been doing this? Make sure they've been doing it. Like, I've been doing this 30 years working with women and their hormones as a board certified OBGYN. They really should have that type of experience. And then they probably should have done an entire fellowship in anti-aging, metabolic, and functional medicine like I have. So they don't only know this little sliver about hormones, they know about how the hormones interact with every cell and every system in your body. All right, so back, I'm off on a tangent. So the reason why I'm pretty sure you're working with a mainstream doctor is because you're on estradiol orally, no. You're on 2 progesterone a day. So pretty much that's the commercially available 100 milligram ones that are mixed in peanut oil. Note, a lot of peanut oil is highly inflammatory, and there's a high allergen rate with that, allergic reaction rate with people. So it can increase the inflammation in your body. So while you think you're doing something good for your hormones, you're actually causing inflammation in other areas that are hurting you in other areas. So I do not like that commercially available progesterone, but mainstream doctors prescribe it because it's inexpensive, it's covered by insurance, and they don't really understand the bigger picture of hormonal poverty and getting to hormonal prosperity. So and some is probably better than none, right? An oral progesterone, oral estradiol and oral progesterone, 2 of the over the counter, is probably better than nothing. I'll say that. Yes, that's for sure. But it's kind of like there's bad and that's nothing, doing nothing about your hormonal poverty. That's way bad. Don't do that. Big, big problem. You're looking for trouble. Then, better is, or good is, use these mainstream pharma preparations. Better is go to a doctor who has training in bioidenticals, and maybe they don't do the proper tests, but they're going to do some type of treatment that's above that, like a transdermal cream and maybe an oral organic progesterone. But the best is do the proper tests, do the right tests, read them the right way, and then give your body exactly what it needs. So not only estradiol, that's one of the types of estrogen, but there are three. There's estrone, estradiol, and estriol. We do not replace estrone. It more often promotes breast cancer. So we replace estradiol and estriol helps to prevent breast cancer. And most women feel their best when they have a certain amount of estriol. There is no estriol available in a commercially available big pharma preparation, whether oral or any other, it's just not available. But if you get a compounded prescription, you can get the estradiol along with the estriol compounded. It's called bi-estrogen, bi for two, estrogen, two types of estrogen, estriol and estradiol. So that's really the best gold standard of what you want, if you can. So we've talked about the estradiol, we've talked about the progesterone. So you would rather have one that's not a big pharma company with peanut oil. It's also an immediate release progesterone, the big pharma one. And I find that women do much better, myself and the women I work with a slow release preparation, which they can create in a compounded formulation at a compounding pharmacy for you, so that it's not like you consume it, and then your level goes way up and peaks and then drops within a few hours. I think the half-life of the commercially available progesterone is 6 hours. So it's pretty quickly out of your system. So the slow release, it builds up less rapidly and then it dissipates less rapidly. So it stays in your system longer. And if you're dosing once a day, 6 hours isn't enough. If that were an antibiotic, they would have you dosing 4 times a day for a 6-hour half-life. So you really want the slow release, which more likely has about a 12 or more hour half-life. So that's the only other thing I would say. But again, you'll need to get that compounded, and the prescription will need to be written by someone who has the expertise to know how to dose that and is it appropriate for you and the drawbacks. All right, what other things did you bring up here? I'm wondering about trying gels or spray that I've read a bit about in case the oral isn't as helpful, protective. Spray, I don't believe that there is a pharmacologic spray or gel for progesterone or estrogen or testosterone for women that is commercially readily available, unless it's an over-the-counter preparation. That means it hasn't met FDA regulatory standards for potency and purity and all the regulations that companies have to meet to prove that their drug has in it what they say it has in it, that it's pure and that it's effective. Because to my knowledge, there is no commercially available or even compounding formulary gel or spray. You will find at compounding pharmacies troches, which look like little, remember the gum chiclets? And it's a little wax chiclet, and you stick it inside between your gum and the side of your mouth, and it melts and dissolves. So that's one way you can dose them. And there are sublingual drops that you can put under your tongue. And there are injectables. I don't ever recommend those. They used to be extremely popular back when I was a resident and came out of my residency, and some of the older docs used to give their women this. But so these sex hormones, just briefly on this tangent, because some of you might find this interesting, they are steroid hormones, and they do stimulate the endogenous opiate system in your body. The opiates are like opium, right? We have natural receptors for that. And it makes us feel good. It makes us feel euphoric, and it can make us addicted to something. So because testosterone and estrogen can stimulate these endogenous opiates you have in your own body, you can become addicted to them. And because the intramuscular injections are so direct and the levels go up so quickly, they stimulate your endogenous opiates so quickly that people typically get addicted, and they need more and more of the hormone more frequently. And they're coming in, they're supposed to get a shot every month, and then they're coming in every 3 weeks, and then every 2 weeks, and I want more, and can you raise my dose? And I once saw a woman early in my career who came in and she had this really low voice because she was on this huge dose of testosterone. Her estrogen was also way high because she had become addicted to them. So I don't like the injections. And I forgot to mention the pellets. Those are also very valid ways of dosing these hormones. However, I am not a fan of, there's a certain branded type of pellets that the doctors are trained to follow blood levels and not do the proper urinary metabolite testing, like the Dutch test that I recommend. And most all the colleagues that I respect use that Dutch test too. And they use blood tests, and it's very inaccurate. And they also don't give progesterone because they'll tell women, oh, you don't have a uterus, you've had a hysterectomy, you don't need progesterone. No, yeah, you do. For instance, your breasts, they need not only estrogen, but your progesterone to balance it out. And when you don't have that balance and you only have the estrogen, that's causing unbridled growth, which is going to increase your risk for breast cancer. All right, great question, Mavic. Thank you so much for this. It's giving us a chance to dive in a little more deeply to these different dosing alternatives. We've talked about methods of testing. We've talked about a whole bunch. So thank you for this very fruitful question. Hopefully you all learned something that can help you on your journey from hormonal poverty to hormonal prosperity. Thanks so much for joining me. I welcome your questions. Until next time, peace, love, and hormones, y'all.